How many of us are dealing with cognitive issues, anxiety, stress, memory issues, fogginess in our brain? Feels like it's the whole world, right? I think as we've gone through these past few decades, we've seen the rates of this stuff increase more and more and more and more. I think most of us would say at any one time, boy, we just don't feel quite right. Um, how do we make that better? That's a real question. My name is Dr. Matt Hand. I'm the Chief Medical Officer for Square One Health, and I'm here to talk to you a little bit about what we're doing to try and make this better. The product I want to talk about today, we call it BU. It's a Bacopa product. And I'm really excited about this one. One of the interesting things about integrative medicine is that if you go and you look at historically what has happened, you go back 1,500 years and you see things that have been used traditionally in other healthcare systems, traditional Chinese medicine, Ayurvedic medicine, what have you. And it's always hard because in a Western world, we're like, well, is it real? Is it not real? You know, how do we scientifically prove it? Is this just somebody making these numbers up? And Bacopa is an interesting one. People would come to talk to me and say, what do you know about Bacopa? And I would say, well, it's an Ayurvedic treatment. It's been used as what we call a neurotonic to help with things like mental health, cognitive function, memory, and even in some cases, anxiety and sleep. But even though the Ayurvedic practitioners were using it forever and said, wow, this is terrific, the problem was a couple things. One, did we have data? Did we actually have scientific data that proved that it would be helpful? And two, how do we get it in? How do we get it to be absorbed so we know what we're getting? Particularly when a lot of the studies, particularly in animal models, were using really high doses, something that human beings might not be able to take. Well, we actually have an answer now, and I love this because we took something that has been observationally noted to be really helpful to now looking at a study that showed that this is really really quite effective. We at Square One Health now have a mechanism by which, using something called BEAT technology, BEAT like BEAT, to actually increase absorption to get higher levels in the blood, so that we can actually make sure we're delivering the product to where it needs to be. And the study, the one that we're using, actually came from this study that was done. So if you look at reviews on this, you can see that there are very specific components of plants that make a difference. So when we think of plants don't just have like a single thing. It's not like an ACE inhibitor that goes to one spot and hits one thing. Plants typically have many, many, many different components. And Bacopa is no different from that. It has bacopicides, it has bacosins, bacosaponins. I mean, there's all these different things. They're hard for me to say. But it has all of these different components that actually impact different components in the body. And particularly working in the neurologic system, working on like antioxidants and oxygen radical scavenging. So it has all these different things that actually can have an impact. And those have been shown to be part of Bacopa. The question was there actually clinical studies that showed a difference in outcome? And just recently, a study came out using the technology that we have for this product that showed dramatic improvements in patients who were taking this in cognitive function, in memory, and also importantly, in anxiety states and in sleep. They took standard testing that you do for these kinds of conditions, and they took about 80 people, about 70 to 80 people, they put them into a placebo control group, and they showed that it worked. They did it over about an 85-day trial, and they showed that over time, they had significant improvement in cognitive function, in memory, and I'm not going to get into all the details. I'm going to go into that in a different video, actually going into a lot of detail about the study, but also in anxiety and sleep. This is very exciting because this is the first time that we have this product. We have this product that's going out on the market, and we're really excited to get this out there. Why? Because so many people are grappling with these issues. So many people are dealing with cognitive issues. So many people are dealing with memory issues. We know that inflammation plays a huge role in brain health and anything related to cognition, memory, anxiety. We're finding out how much more this plays a role in these conditions. So we're really excited to have, it's called BU, it's Bacopa, it's part of our Square One Health product line, and we want to get this out for people. We want to get this out there so people can really start using something that is data driven to help their cognitive function, and to just help them feel better. We call ourselves Square One because we start from square one. We're starting from the beginning of this journey. We're not using reduction theory. We're looking at things to look at complexity and how everything impacts our lives. And as we move forward, we're going to get into more discussions on other treatments, other things that people can do from a health-based standpoint in terms of improving their outcomes. But importantly, having something that was shown 1,500 years ago to be effective and observationally observed, and now actually have the scientific study that shows that this is helpful with the technology that we're using is really critical. I always say, if you simply look at the single leaf of the tree, you miss the beauty of the thousand leaves. In medicine, we always focus on the one leaf when we really need to focus on the tree. We focus on the tree, we make the tree healthier, then that leaf becomes less of a problem. So at Square One Health, that's what we're working on to try and improve people's overall outcome. And BU is a really great product. We're really excited to have this out there. And I'm really excited about this last study that came out that has now scientific data to back up all the things that we saw, that